Hello, everyone, and welcome back to Voices Speak Volumes. Joining me today is Dr. Dennis Quo, who happens to be a man of quite a few titles. He is the Division Chief of General Pediatrics over at UBMG, and he is also the Medical Director of Primary Care Services over at Oishei's Children's Hospital. Dr. Quo, thank you so much for joining me today. Can you tell us a little bit more about your background as it relates to the special needs community?
I really focus on primary care. About 20 years ago, when I started just having a real interest in children with complex care needs and disabilities, um, really because I feel like it's an area where we as professionals can partner with families and really make a really big difference in the lives of children and families. Uh, I also run the special needs clinic at Niagara Street Pediatrics, where we see children with medical complexity. We take care of their primary care needs. And I'm as the interim medical director over the Robert Warner clinics at Oishei Children's Hospital. We also see a number of children with complex care needs there, both medical and developmental complex care needs.
So today, Dr. Quo and I are going to be discussing the current COVID-19 climate as children are returning back to school. Dr. Quo, the first question I want to ask you is, in what ways, if any, are children with special needs and special health concerns more susceptible to catching or contracting COVID-19?
That's a great question. I think a lot of attention has been paid to thinking about whether children with special healthcare needs are at increased risk. There are some that we would consider as more biologically at risk for severe illness. Most children with special needs likely are not at really increased risk, as if their care needs are taken care of, if their chronic conditions are relatively well managed. I wouldn't consider them at increased risk. There are some, we're talking about children with really severe lung disease, severe chronic illness requiring technology dependence. Those kids have shown up in intensive care units at a higher rate than kids who don't have those needs. But we're talking about some really severe medical complex needs. Those are the kids who really are at increased biological risk. As a whole, biologically, children have not been really at increased risk for illness, particularly compared to adults. And that's been one of the interesting things about this whole COVID thing. The older kids, we're talking 10 and up, and particularly as you get closer to the adult years, those kids as a whole have been shown to contract COVID probably as easily as adults, to transmit it as easily as adults, and to also be an increase for getting sick compared to the younger kids. Kids under 10 as a whole generally aren't just getting sick. We're seeing mild illnesses or no illnesses, and children that young have a higher chance of being asymptomatic. So when we talk about the effect of COVID on children, there's a small group that are increased risk for becoming so sick that they come into hospital. And we really need to protect those kids from getting sick. The other kids, the rest of the kids, we really should be talking about the effects of the shutdown, the effects of how our society has really changed, and making sure that all of their schooling and their emotional and their family needs are met. And the way to do that is actually to control the transmission of disease in the community, because the effect on their schools, the effect on their parents, the effect on their caregivers, that's a big issue, and that's what we really need to be talking about for our kids.
Now, with schools reopening, there's obviously a lot of concern about numbers increasing and possibly there being a second wave of the coronavirus. We've already seen a few cases of coronavirus, since we've reopened schools, particularly in college-age students, but in schools overall. What would be your advice as far as precautions, as school is reopening? What precautions should we be taking as we acclimate back to our so-called normal lives?
Number one thing is that if the community transmission is high, that's when we start seeing it get into schools. If the community transmission is low, and we know it's low, and we test individuals and we isolate any hotspots, the risk to kids is probably pretty minimal, but we always have to watch. There are schools around the country that have opened up, and they've opened successfully. but certainly they made sure that their community transmission was low, and there was really just a buy-in from the community to make sure that transmission was low. State and local policies really need to support interruption of transmission. Um, there needs to be enough testing. There needs to be enough buy-in for the community. There needs to be a culture that wears masks and interrupts transmission. If we as a community are committed to keeping the transmission low, then schools can open. That's the number one thing. This is definitely a time where people are pretty anxious. There's a lot of decisions that go into schools, particularly with the role that schools play in the health, growth, and development of kids, particularly children with special needs, cannot be understated. And once you establish that community transmission is low, there's a whole series of steps that schools and families can take in order to keep schools safe and for children and teachers and their caregivers. Every school district will have their own plan, and I encourage folks to read their plans and just make sure that it matches the needs of your child, for in terms of returning to school. But there's definitely not a one-size-fits-all solution for making sure that children's needs are met through school. Some children will do better with remote learning. Some children would do better with in-school learning, but certainly we want the opportunity for all children to meet their goals and their needs. More kids probably need to be in school to be able to get the maximum benefit, but for children who really do need to be remote, we need to make sure that they have their needs met as well.
Now, I know mental health is not exactly your specialty, but mental health is obviously on the vanguard of so many families' minds. So I would be remiss if I didn't ask you, what advice would you offer to parents, caregivers, and even students when it comes to managing their mental health in this unique and challenging time?
The number one thing is that families need to take care of themselves. If contributing to all of this with COVID is that we just disrupted a massive amount of services over the last several months. There was a lot of families that are hurting economically. There's families that have issues with food, with their monthly bills, and we need to make sure that parents and families are taking care of themselves at a baseline. The more we can keep to structure and routines, the better. We certainly need to be asking and paying attention to how our kids' mental health state is. Some kids, interestingly, have done better with quarantining or staying at home because if there's a certain amount of anxiety with going to public places, they seem to do okay at home. And so adjusting to going back to school actually is the issue. There are other kids who really needed that contact with other kids, and being cooped up in their houses for 5 months really took a number on their state of their mental health state. I ask every parent with special needs to pay attention to their child's state of mental wellness. We know that for any given chronic condition, that the rate of comorbid mental health diagnosis tends to go up. So, you need to pay attention to even the basics like sleep, exercise, activity, general mood, contact with their friends. And sometimes you just need to ask your kids or just ask direct questions to the parents. How's your kid doing? And then really get into specifics like how's sleep, how's eating, how's appetite. Is your child happy? Is your child upset? And then be able to talk about those things. Lastly, I would say that just because we had a pandemic did not mean that services stopped, did not mean that IEPs stopped. They changed because instead of having 5 days a week in-person services, they changed, but they didn't stop. And so following up with your child's IEP is really crucial right now. IEPs may have something in them about counseling or behavior or mental health. They need to be updated. They may need to be revised. They may need to have compensatory services for the 5 months that the child was at home. And so that's something that every year we know that if children need their IEPs updated, those are things that you have to account for the remote learning and for the fact that the child was at home.
Now, the last thing that I want to discuss with you is the East Side Clinic. Now, you guys have already gotten a head start with moving over to 1021 Broadway. We will be moving to 1021 Broadway next month, which I am so very excited for. Can you tell us a little bit about what the clinic has to offer?
So as a medical director of primary care, we deliver primary care to 11,000 children through the city of Buffalo. And our goal is to provide every child with comprehensive care. So, you come in not just for heights, weights, and shots, that we take care of all of your needs. We know how many children, really need their psychosocial needs met as part of their preventive care, and how it takes a community of services to raise healthy kids in healthy communities. What I'm really excited about being co-located with so many great folks in the East Side is how it develops those relationships with partners to be able to, number one, if a child is in need of referrals, that you can just send them upstairs, you can send them downstairs, you can send them to people you know, you can send them to people that you're familiar with, but also to develop programs where we're all working together with specific programming needs. We're looking at can we install people in each other's spaces, respecting, of course, the current pandemic, to be able to plan programs that screen for and automatically refer and provide resources for children. To me, it's not just about referring those where we see needs. It's about preventing issues from happening. It's about nurturing healthy parents, healthy communities, healthy children by making sure that our kids are read to, making sure that we screen up front for developmental delays, for mental health disabilities, making sure that we address temperament, that we address behaviors, and that we support parents as a group, as a community, in supporting the healthy growth and development of children. These are things that pediatric practices and family practices are very much interested in, but we cannot do alone. And so having so many partners to not only refer to, but also to plan programs, to be able to plan interventions, to be able to plan steps for partnerships up front, to be able to promote healthy growth and development. That is a really exciting thing about being co-located. I'm just really super excited.
I am so excited too. Teamwork makes the dream work. What can I say? Thank you so much for talking to me, Dr. Poe. I really appreciate it.
All right, thank you.
And thank you guys so much at home for tuning in. As always, you can find our contact information right at the bottom of your screen if you need to ask us any questions. We are definitely here for you. And thank you guys once again for watching, and I will see you guys next time.